I'm sorry. Okay, so let's go back and let's learn about someone who knows nothing.
Okay.
And they say, all right, this sounds cool. Tell me about what all these different letters and numbers and acronyms and all this stuff. What does that mean?
Okay, absolutely. So, like I said, a lot of times when you're in a clinic, you're in the hospital, you're in whatever, someone's going to come in and say, hey, I'm so and so, I'm and insert alphabet soup. I'm a CNA, LPN, APRN, FNP, this, that, or the other. And a lot of times you are left wondering, what on earth does that mean? I hope this person is qualified to take care of me. And the answer is yes, they are qualified to take care of you if they've been there, they've gone through a credentialing process. But let's kind of break down that alphabet soup so you know who it is that is taking care of you and kind of what education they've had and where they come from. So we'll start with CNA. CNA is a certified nurse assistant. To be a CNA, generally, you can do it a few different routes. Sometimes high school students will actually do it through their hosted classes. Other ways to do it, so you can also go to vocational school settings, or even sometimes facilities such as nursing homes or hospitals offer a CNA class. So generally what this is focused on as a CNA is taking care of a patient's what's called ADLs, or activities of daily living. So feeding, bathing, walking, dressing, all of those things that the patients cannot do on their own, the CNA is going to be responsible for helping them do that. They assist the nurse with whatever they may need assistance with, along with generally CNAs are also responsible for obtaining vital signs. Now, a big piece there, they're not in charge of interpreting vital signs, meaning that they can't make a decision that a patient needs a particular treatment based on those vital signs, but they can obtain them and report them back to the nurse. So that is what a CNA, or a certified nurse assistant in a nutshell, will do. The next step is your LPN, or your licensed practical nurse. They also can be called vocational nurses. Generally, they will get their education through some sort of vocational school, hence the name. You can get your LPN through a place like TCAT in Tennessee. Generally, what they do, they work in settings such as clinics, nursing homes, assisted living, sometimes in the acute care setting. What separates LPNs and RNs is the education. When you start talking about RNs or a registered nurse, there's actually two different routes or two different forms of education that you can become a registered nurse. One of those is through the associate's degree, or what's called an ADN program. Generally, these are through your community colleges. I think of places like Columbia State. I went to school in Chattanooga. Chat State had a program, things like that. So whether you have your ADN or your BSN, you can still become a registered nurse. The difference is your associate's program are going to focus on the skills and what you need to take care of patients after you graduate and obtain your license. To obtain your license after you graduate, you have to take the NCLEX, which is the licensing exam. And it's a national exam you have to take and pass that. And once you pass that, you can become a registered nurse. So looking at education, BSN versus ADN, or the associate's degree. The associate's degree classes are going to focus solely on those skills that you need. For example, you're going to take classes like Med-Surg 1 and 2, pharmacology, women's health, pediatrics, psychiatric nursing, things like that, so that when you get out of that program, you can take care of a patient. The BSN classes that they're going to throw at you on top of the courses we just mentioned include research, so it's specific to nursing research, so how you can kind of take a process in nursing and make it better and do research based on that. Leadership, how you can become a better nurse leader, pathophysiology, and classes like that. So generally, when you graduate, you can take care. You have both forms of education. You come out with an RN, so you can come out eligible to take the NCLEX to become a registered nurse. So you can take care of the same types of patients. You are created equal because of your license. What sets you apart generally is that most of the time, now, not always, there's never a blanket statement that says always, but generally for those management positions and leadership positions, they want you to have your BSN, just because the management pieces are just going to be that research, that leadership, and they want you to have those courses so that you're better prepared to lead and to really be the best leader you can be for those nurses under you. From RN, or you can kind of move on to your master's degree. You can become what's called an APRN, which is an advanced practice registered nurse. That is an umbrella term for 4 different types of providers or nurses. It requires a master's degree, so you have to have your BSN, and then you can get your MSN, or your Master's of Science. Now, There are nursing programs out there that will bridge you from your associate's degree straight into your master's. You're going to have to take the same courses you took as your bachelor's degree, but it'll bridge you, and sometimes it's a little bit faster. So the different things, there's 4 different groups that fall under the umbrella term of APRN, or Advanced Practice Registered Nurse. That be your nurse practitioners, so your family nurse practitioner, your acute care nurse practitioner, and so on and so forth. Your CRNAs, which is the Certified Registered Nurse Anesthetist. Those are the ones that you see in the ORs in different places, and they are working hand in hand with the anesthesiologist. You have your nurse midwives, and those are the ones who work directly under the care of OBGYNs, and they're the ones who can focus on women's health and labor and delivery, or delivering those babies. And then you have what's called a CNS, or a clinical nurse specialist. So all 4 of those can fall within the umbrella term of Advanced Practice Registered Nurse, once again requiring a master's degree. After that, you can get to what's called a DNP, or Doctor of Nursing Practice. Generally, that is focused on research and making, you take basically an issue or a problem in nursing and you expand on it, and your dissertation, if you will, is how you can make that process better. Another term that you might hear in the hospital that you have no idea what it means is respiratory therapy. They'll come in and say, I'm your RT. Respiratory therapy work hand in hand with nurses, but they are not considered a nurse. They go to school. There is a program at Columbia State. It's a respiratory therapy program, and basically they know everything that there is to know about the respiratory system. From ventilation to oxygenation, they're going to be able to take care of you. They're generally the ones who assist in intubation, or when you have to breathe for a patient. They set up the CPAP machines. They do the breathing treatments and things like that. So that's also part of that alphabet soup that gets thrown out, is that RT, or the respiratory therapy. Now, I know that I'm leaving people out, but just for the sake of our time and including nurses, that kind of breaks down your alphabet soup and allows you to kind of understand the education level and who's taking care of you. There's also certifications that you can obtain, but there's specialty certifications. For example, I have my CEN, and that just stands for Certified Emergency Nurse. It just means that I've been an emergency nurse for a while. I took a very long and very difficult test, and now I'm certified to be a certified emergency nurse. So there's also a few more letters out there, but that's the most popular letters, or the most frequent letters, if you want to say popular, the most frequent letters that you will see to kind of break down and understand.
So, bottom line, if you're listening on the podcast, you can take that as you may. You can slow it down, bring it back, just to make sure you have the baseline of all these different steps and places you could be as a nurse. Is that all under nursing?
Yes.
Is that what all
of that? Again, respiratory therapy is not necessarily considered in nursing.
Yeah.
I just want to throw that out there because they're part of the everyday care in the hospital. I don't want to leave them out. But everything in there falls under the umbrella of nursing.
Okay.
And one thing that I kind of want to, you may ask this in a minute, or may have thought about asking, one thing I want to kind of clear up is that it's not necessarily a stair-step process. Don't feel like you have to do one before you can do the other. I've never been a CNA, and I've never been an LPN. I went straight into my program in nursing school, and when I graduated, I had my BSN, and 3 weeks later, I took the NCLEX and became an RN. So it's not necessarily a stair-step process. So don't feel like, wow, if I ever want to be a nurse practitioner, I got to go through a lot of different things. No, It is a lot of different work, but don't view those letters and certifications and license as a stair-step process. There are things that kind of, like I mentioned, the bridge program that can bridge you into another program to get you ready to rock and roll for that.
Okay, so we have our first question here. On average, how stressful is this job?
That depends on a lot of different things.
It depends on the person, right?
Of course, it depends on your personality.
All right, so let's take your take.
Okay.
How stressful is this job?
Being in the emergency room every single day presents with it something different. The biggest thing, it can be extremely stressful. I'll put it that way. It can become very stressful, but it's all about how you handle it. So on the inside, you may be freaking out, but on the outside, you have to be the calm, collected nurse that's ready to take care of whatever's in front of you. So it's different type of stress, right? So it's with all jobs, it's different type of stress. With different types of nursing, it's different type of stress. It depends on what type of unit. Is it a critical care unit? Is it a med-surg unit? Is it an ER? And what is the type of stress? So really and truly, yes, there's not a single nurse out there that'll tell you it is not stressful. It is absolutely stressful. But it's all about how you handle it It's all about your leadership. Does your leadership support you? Do you have the resources that you need to take care of patients? And that is something that before you ever take a job, you need to look at the leadership and the resources. Right. Because if you don't feel like you can adequately take care of your patients, it's never going to be a good day, and you're always going to be stressed. Again, some days are better than others. There's some days that I walk away from the hospital, I'm like, I love this job, I love it. And there's some days that I'm like, I'm never coming back again. So it just depends on the day, and it's all about the team around you. It's all about your leadership and being there to help each other, help take care of the patient. So to answer the question, yes, it is stressful, but it just depends on the day and depends on that patient population.
Gotcha. Okay, and so what hours do you work?
Okay, so it just kind of depends on the day. I actually work 2 different types of shifts. I either work 7 a.m. to 7 p.m. when I'm at the hospital, or I work what's called a mid shift to kind of help with the influx of patients. I work from 11 a.m. to 11 p.m. And that's kind of interchangeable. I try not to do a 11 a to 11 p and turn around and do a 7 a, 7 p the next day, but it's happened before. But generally, in the hospital setting, you will work a 12-hour shift.
Okay. And so during that shift, do you get like break time, or do you have to find a break time and lunchtime, or how does that work?
The answer is yes.
Okay.
And it just, like I said, it depends on the day. That there is, you're required by law. OSHA states that you have to get a lunch break, right? So it just depends on your patients. It depends on the day. There have been days that, at 11:30, I'm like, okay, I'm starving. I'm at a good place. I'm going to go eat lunch. Now, it's not one of those things that's, all right, peace, I'm going to eat lunch. For, I'll be back in 30 minutes like other jobs. I have to talk to my charge nurse, and I have to talk to the other nurses I'm working with to make sure that my patients aren't forgotten about for 30 minutes. Different facilities I've worked at, I've had what's called a hall partner. So I'll give a mini report to that hall partner and say, hey, I'm going to lunch for 30 minutes. Call me if you need me, but here's what my patients need. Here's what's going on. Other places the charge nurses cover. But then at the same time, there's been times that, you look up and it's 3 p.m., it's 3:30, you're starving because you've been there since 7 a.m., and you just don't see a lunch break in sight because of what's going on, the acuity of your patients and things like that. So at some point, you will get a lunch break and be able to eat. It just depends.
It might be like 3 days late.
Exactly. And I will say, hospitals and administration, they know that, and they try really hard to help you out. And, there's some days it just doesn't happen. You have to eat a snack and just keep going. But when you clock out, you can clock out that, hey, I didn't get a lunch break today. Don't take that on my paycheck.
Gotcha.
It's 30 minutes, but still it's 30 minutes that you worked, and I want to get paid for that.
Exactly.
So, ideally, in the perfect workplace, which that doesn't exist, you do get a 30-minute lunch break at some point. But when it comes, is depending on the day.
Game time. It's game time.
Exactly.
Right? So next question here. What would you say in, again, this is going to be different and it's not an easy answer, but what is a average day? Like when you could tell someone in an elevator, the elevator pitch.
Yeah.
What's nursing in a day?
So nursing in a day, we'll do a general view, and then we can kind of look at an emergency room.
Yep.
In a general view, what is nursing? You get there and you're going to get a report from that nurse that's had those patients beforehand. You're going to do things like assessments. You're going to assess that patient and see if they're progressing or getting worse. Hopefully they're getting better. You're going to do things like medication administration, whether that be that they're taking it by mouth or an IV administration, whatever it may be. So assessments, medication administration, depending on what type of patient you have. The physician or nurse practitioner, the physician assistant, whoever the provider is going to put orders in, and you're going to try to fulfill those orders to the best of your ability, whether it be things like their diet orders, so what they can eat and what they cannot eat. If they're post-op and they need to walk today, you're going to help physical therapy walk. You're going to do things, you're going to help respiratory therapy, as we mentioned, with breathing treatments, and it just depends on, number one, why the patient is there and what they need, how your day looks. What's different in the emergency room is that if you're the triage nurse, that you're going to spend 12 hours triaging patients, saying, hey, this is why you're here. You need to be brought back immediately because you're very sick, or you can spend a little time in the waiting room. We'll get you pulled back when we can. Or if you're in the back, then you're going to be taking care of patients again based on their chief complaint. If it's a respiratory complaint, you're going to do things to help them breathe better. If it's a chest pain cardiac patient, you're going to do things to hopefully figure out what is causing the chest pain or the cardiac issues and get them figured out, whether we need to send them to the cath lab, to the hospital for observation, or if it's acid reflux that's actually causing this chest pain. So it just depends on the needs of your patient. It depends on how your day goes.
All right. So I want to ask you a question. It's also in here. Have you ever seen something in there, just in general, that just makes you sick? You're just like, oh, I can't handle this? Or do you know that with your job that's just how it is?
I can honestly say the thing, like if you look at something that makes me quote unquote sick, um, physically sick where I'm going to be nauseous and can't handle it based on the injury, that's never happened. I just, things don't really bother me. I can be elbow deep in something and disgusting, and 5 minutes later I'm starving. I'm going to go eat lunch because that's just the way the day goes. The things that quote unquote make me sick is when you feel like you can't take appropriate care of this patient because of lack of resources, because of environmental factors, or if there's situations of neglect or abuse.
Gotcha.
That's what I really struggle with the most, is trying to help this patient out as much as possible, but then also being restricted by legality factors. So as a physical sick, no, but emotionally sick, absolutely. There's things that you see every day, and I made the comment that last time I worked, it's like, these people's home life, that like it's very scary what some people have to go through, and you just gotta keep that in the back of your mind, because sometimes you have those patients that just treat you very disrespectfully or very rude, and there's never a justification or excuse for that. But at the same time, I try to take a step back and think, this may be all they know. This may be a defense mechanism. Maybe this is all they know at home, and this is how they survive, is by being cruel, because that's all they've been treated with, is cruelty. So that may or may not answer your question. I hope it did.
Does. It does. So another question here. Are you ever afraid? The question is, are you ever afraid that you'll give someone the wrong medicine? But I want to make it bigger, and I want to say, are you ever afraid to make those calls? Like, are you the person making the call? Like, what are some of the decisions you have to make, and are you ever like afraid to make those decisions?
So when we start talking about medicines, again, this is going to be in the emergency room or the hospital setting. There's different settings, but this is in the hospital/emergency room setting. So what's going to happen is a physician is going to put in an order, or again, some sort of provider, I should say, a healthcare provider, that being nurse practitioner, physician assistant. Someone's going to put in an order, okay? Or you've been a nurse long enough and you know what this patient needs, and you can ask that provider, hey, this is what I think they need. What do you think? They're going to do one of two things. They should put the order in, which means that they put it into the computer, but you can also accept a verbal order. When you accept that verbal order, you put it into the computer.
Gotcha.
Because once it's in the computer, then the system of checks and balances starts. So then once it's in the computer, it crosses over to what's called the PICSIS, which is basically the automatic medication suspension system. So you go in there, you have to log in with your fingerprint and put in your password, and then you select the patient and you select the medication that you want to give, and it gives it to you, right?
So it's like a vault?
Exactly. It's a vault of medication.
Gotcha.
It's all locked up based on what, some of it was refrigerated if it needs to be refrigerated. So what you're going to do is you're going to get that medication, and it's called the 3 checks, and I think now it's up to 6 rights. So you check at least 3 different times to make sure that you have the right drug, the right patient, the right route, the right dose, and the list goes on. So we now have scanning, so I call it, the Walmart scanner. So I'm going to so if you're in the hospital and I have the medication, it's been ordered, I've pulled it out of the med room, and now I'm going to the patient's room. So I get in there, and I'm going to verify your name and date of birth to make sure we are talking about the right patient, that I didn't go in room 4 and think I'm in room 5, right? Yeah. So then I'm going to scan your wristband, right? So I've pulled you up in the computer. I've got you in the medication administration record, or the EMR. I've got it pulled up in the computer. I'm going to scan you, and that's going to link. So if, for example, I think that I'm in John Smith's room, but I've scanned Joe Smith's room, it's going to bounce back and be like, hey, something's not right. This is not the right patient. So,
like you said, checks and balances.
Exactly, checks and balances. So once you get that far and you scan the patient, it's the right patient, then you're going to scan the medication. So if they're supposed to take, let's just say, a generic 10 milligrams of a medication, and you scan it, but that tablet is 20 milligrams, well, it's going to pop up and say, well, you scanned 20, so maybe you got to break it in half, something like that. So that's just another way to check, hey, I'm giving it to the right patient, it's the right dose. Am I supposed to give this as a shot intramuscularly? Am I supposed to give it IV? Or is it a tablet and they're going to take it by mouth? So that's something that's very important too, because some medications, act very differently whether you give them via muscle or via IV or intravenously. So am I ever scared that I'm going to give the wrong patient the wrong medicine? It's a thought in the back of my mind. I won't say that I'm scared. It's a healthy respect to know that I need to make sure that I'm following the checks and balances. Ultimately, if you're following the checks and balances set forth by the nursing process and by the hospital, you shouldn't make a mistake. Now, mistakes still happen.
Right.
But if you're paying attention, you're being cognizant of what you're doing, and you're following the checks and balances, then you should be able to do it in the correct way, in a safe way. Because that's ultimately, at the end of the day, we want to walk away with safe nursing practice.
Right. And I wouldn't say it gives you a peace of mind, but it's just something else that helps you do your job. Right?
Absolutely.
And when you're talking about stuff like that, that's super important, and you don't want to mess it up. So the more checks you can have,
right,
the better it's going to be.
No, and of course, in the emergency setting or in a critical care setting, you could have an emergent patient that needs something very fast.
Right, and
and the checks and balances aren't always there because you're not going to take time to scan that if they need, you hear in the movies the give one of epi, right?
Right.
So if you're doing that, but generally, there's still checks and balances there. There's still things you can look at, and it's something that comes with experience that you're going to be more confident that I've been here, I've done this. It's not an arrogance, because when you get arrogant it's when bad things happen.
Right.
But it's the level of confidence, but also a healthy respect of what you're doing.
So have you ever had anyone refuse care? Like,
Yeah.
Hey, you need this, and they're like, no. So what do you do?
Absolutely.
You just do it, or don't do it?
No, absolutely not. It happens all the time. And we have patients who refuse care. We have patients who, and there's a difference. If you are determined that are deemed that you are a threat to yourself or the community, you can put a legal hold on those patients. Now, those patients still have rights. They still have rights to refuse treatment. However, the difference is they cannot leave. They are now on a legal hold.
So it's take treatment or don't leave. Is that right?
No, with those patients, so they're on a legal hold. They do not have to take treatment, but they cannot leave. We're basically working to get them into a psychiatric facility because they're a threat to themselves or a threat to the community. Usually it's a psychiatric complaint. Now, on the flip side, if they are a competent adult who has come to your facility and they don't want the care that you are trying to give them, they do not have to accept it. You're going to explain the risk and benefits. You're going to document that you explain the risk and benefits. But at the end of the day, they're a competent adult responsible for their health. And if they do not want that care, that's their decision.
You say, okay.
So at that point, we can do what's called an AMA form, or against medical advice. And they're probably going to sign that form and they're going to leave because they don't want the treatment that we've prescribed. So do we ever force someone to do something? Absolutely not, because
that's not your role, right?
Right, it's not our role, and it's quite frankly against the law.
Well, yeah, but I'm just saying, like, that's not why you're there.
Right,
you're
exactly.
there to help them, and if they don't want it, then you don't.
Exactly. If you don't want our help, we're gonna try to talk you into doing this.
Of course.
But at the end of the day, we can't force you. So if you don't want it, then we're gonna do the best we can, and we're gonna document that we did the best we can. But at the end of the day, it's your choice.
All right, so let's get back into the information part of it. So you let us know about all the different, are those classifications? Is that what the word would be, or what?
Yeah, you can say that. Different roles and responsibilities.
Different roles, okay. So we know the different roles. Now, what do we do? Like, okay, I'm a senior in high school.
Okay.
Where do I go? What do I do? Is there a website I should go to? Is there people I should talk to?
So the first thing that you need to decide is what you want to be, right? So if you think to yourself, I want to be a registered nurse. Okay, awesome. All right, the first thing you need to do is when you start looking at universities, are you going to go the associate nursing route, or are you going to go the bachelor of nursing route? And the first thing you need to do is when you start looking at universities is, do they have a nursing program, right? Because if you want to go to, and a lot of universities have nursing programs, okay? But you need to decide wherever you're going to go that they have a nursing program, or go into it knowing that you're going to have to transfer at some point, because if there's not a nursing program in that university, then you can't go to nursing school there, right? It doesn't make sense. It's just like any other major. If they don't have a business degree there, then you can't go into business at that university. So a lot of times what people will do is just to start getting experience. A lot of high school seniors will go ahead and take that CNA class. Most high schools now have the HOSA programs, or the Health Occupation Students of America. Most of them, once they finish the HOSA program, will already have their CNA, and they can start working. But the biggest thing is deciding if you want to go the college route. If you want to go the community college or the college route, is deciding on a university or a college that has the nursing program. Once you figure out that yes, they do have a nursing program, the next step is meeting with that nursing advisor. They are going to be your life source for nursing. They're going to tell you all the requirements. They're going to tell you the classes. They're going to literally say, hey, this is what you need to do to make sure that you can be successful in our program. This is the classes. This is what we recommend. We recommend that you get a certain amount of volunteer hours. We recommend that you get a certain amount of shadowing hours so that when you submit your resume to get in our program, you have a better shot of getting in. So finding the university that has a nursing program and then talking to those advisors. I still am in touch with my nursing advisor today. I sent her a wedding invitation because she was my lifeline for all things nursing, and she was wonderful. So find that nursing advisor at whatever university you pick and become friends with them and allow them to guide you through the process of getting into the program. Now with the programs, typically the associate's degree, so you do 1 year of prereq. So let's just say Columbia State, for example, they have an associate degree of nursing program. You'll do 1 year of prereq, so getting some of your science courses out, and then you'll jump in that second year of college, and it's a 4-semester program. So after 4 semesters of nursing school, you'll have graduated with your associate's degree in nursing, and then you can sit for the NCLEX. If you go the bachelor's degree route, generally you're going to take, it's going to be a 4-year program. So associate degree, it's 3 years. BSN is 4 years. Generally, of course, it's going to be university specific. You're going to take 2 to 4 semesters of prerequisites or general education courses focusing on those anatomy and physiologies, microbiology, pathophysiology, etc. And then you're going to do 4 to 5 semesters in nursing school. So you get accepted, again, talk to your advisor to figure out what that process looks like, and then you're in nursing school. And once you finish nursing school, you can sit for the NCLEX.
That's a lot.
It is a lot. It is.
But I mean, you're talking about years and years. I mean, you're talking about 4 years at least, right? So there's a lot to do.
It's a 4-year degree. So BSN is that bachelor's degree of nursing. It's a 4-year degree that makes you eligible to take the NCLEX. When you graduate with your BSN or your ADN, your associate degree in nursing, you are not able to practice as a nurse until you get that license. You must pass the NCLEX and get that registered nurse or that license to make you eligible to practice.
How hard is the NCLEX?
So the NCLEX is pretty difficult.
Yeah.
It has to be.
I could assume it would be,
Yeah,
right?
absolutely. There's good news is most nursing programs have an NCLEX prep course. So just like when you look at high schools, you know, those ACT prep courses, you have NCLEX prep courses. So they're going to get you ready because it looks bad on the university if they produce nursing students who cannot pass the NCLEX. That means they're not a good program. So the nursing programs are going to do every single thing that they can to make sure that you're going to pass that NCLEX, because this is one thing to look when you're looking at universities and nursing programs, is look at their NCLEX pass rates. If their NCLEX pass rates are out the roof, that's a program you want to be in. If they're really low, like in the low 90s or 80s, not saying that they're not a good program, but you need to be very aware of that going in, okay? You want someone that has a 100% pass rate, because again, if you have a nursing degree without a nursing license, there's not a whole lot you can do. You've got to have the license.
When do you take this test?
The NCLEX. So you take the NCLEX after you graduate. So whenever it is that you graduate and you officially have completed all the requirements of the nursing program, then you can submit an application to the Tennessee, if you're in Tennessee, to the Tennessee Board of Nursing, whatever state you're in. So a little piece here, if you're going to school in Tennessee, but you know you're going to go to practice in Alabama, then you need to apply to the Alabama Board of Nursing. But let's go back to Tennessee. You're going to apply to the Tennessee Board of Nursing and basically get permission to take the NCLEX. They will then grant you permission and they'll give you a PIN number. Once you have that PIN number, you're going to look up the different testing sites that offers the NCLEX. And you're going to pick a date, time, and location that works for you. And once you've picked that date, you enter it in, you pay for it. I cannot remember exactly how much it is, but it does come with a fee to take the NCLEX. And then whenever you pick that date, time, and location, you'll go and sit for the exam. The minimal amount of questions that you can take is 75 questions. So at 75 questions, it may cut off and you're done and you've passed it. You're good. You've met the certain requirement. But minimal number is 75, and I think, don't quote me on this because it's been 2.5 years since I took it. I think the max is 200 to 250. Don't quote me on that. I cannot remember. But
We're quoting you on
we're
it.
okay. But basically, in about 24 to 48 hours, you'll get an email and says, "Congratulations, you're now a registered nurse," or "You did not pass the NCLEX," and you can take it again. There is a waiting time. I think the waiting period is 30 to 45 days. It may be more or less than that. I can't remember. But the good news, it's not a one and done. If you fail, you can never be a nurse. You can retake it. It just becomes expensive because it is.
They want your money, right?
Absolutely. And then after that, to keep your license up to date, you have to meet the minimal practice requirements by that state, and then renew your license every 2 years, which again comes with a fee, but it's a small fee to have a job, right? So every 2 years, and that's one thing that you have to be sure that as you are keeping up to date as well, not letting your license expire, because again, no license, no job. So that's kind of the, in a nutshell, route to getting your license.
All right. Well, thank you all for listening and asking your questions. Thank you, Paten, for doing
Absolutely.
this, and we're out.